Well, good morning, everyone. Again, I'm Bob Ravenscroft, the Vice President for Advancement and Chief Development Officer here at Bryan for our daily media briefing. I'll share a few statistics, and then who we have with us today are Dr. Dave Miers, PhD, not MD, Dr. Miers. Dave is responsible for the Bryan Independent Center and Mental Health Services here at Bryan. And we also have John Woodrich, the Chief Executive Officer at Bryan Health as well. Before I share some statistics, I just again want to say how much we appreciate your live tweeting, your coverage of this. It is an inspiration to our team to see what is being done throughout communities and by people throughout the state. And we're learning about this from you as we hunker down on the healthcare related things. So again, your role is vitally important here, and we cannot thank you enough. Another kind of anecdote on that, personally I've seen it, and our digital team has seen it, that the kind of civil responsibility is taking an uptick, and I believe it's because of the information that you are providing to the public and how they are engaging with the misinformation that is out there in the social media era. So thank you for all you're doing. As of now, we have still only tested 22 people here at Bryan. Now 20 of those 22 have come back negative, and we have 2 pending results. Those results are not at the state lab, they are at a commercial lab. Just to remind everyone, it was covered yesterday, but to test a person with the COVID-19 test now, we get clearance from the state because the commercial labs are backed up. The state authorizes our ability to go forward with a test, and then it's forwarded to them. John will cover a little bit about our work to still set up our own testing capabilities here. The Easy Visit questionnaire has now had 4,017 questionnaires filled out. 607 of those have gone to the next level of Easy Visit evaluation, and 244 individuals have used the COVID-19 promo form. Again, that is important for people because that is what waives the fee for that. There were some questions about bed availability yesterday, just so everyone is level set as we prepare for potential surge down the road. We have 538 active beds between the Bryan East and West campus. We are licensed for 640 beds, and our midnight census with caring for people that we routinely care for here was 454. So there is the capability for surge in the future if needed. Yesterday, before I turn it over to our other 2 gentlemen, we shared a little bit about what our employees were doing in their volunteering for shifts outside of their other area. And we're certainly proud of them. But we're inspired and heartened by what the community is doing for us. We hear how people are keeping us in our thoughts and prayers. You're in ours as well. And one example that are kind of wrapped together that I just want to call out. You're hearing a lot in the national media, locally as well, about the supply chain challenges for personal protective equipment. And this week we received notification from Sampson Construction that they are donating 595 masks for our team to use. Hausman Construction donated 9 PAPR hoods with motors. PAPRs are powered air purifying respirators that are going to be a great assistance to our team as we have to protect our staff as well. And additionally, we've had independent contractors throughout the community contact us about the potential of donating some of their excess N95 masks as well. So again, these things are incredibly motivating to us as we deal with this, to know that people are behind their healthcare system and thinking of us. We cannot thank them enough. If you know John Sampson or Corey Vokun, please thank them. If you know Joey Hausman or anyone from Hausman Construction, thank them. It's greatly appreciated, inspiring and motivational to our team. So with that, I'm going to have Dave Miers. Again, Dave is the Director of Mental Health Services in the Bryan Independent Center here, to talk to you about ways you can cope with something that might be here for a while with us. Dave?
Well, good morning. My name is Dave Miers, and I've been here at the Medical Center for 23 years. And this morning, I'm going to talk to you about the fact that your daily mental wellness and self-care is vital during this COVID-19 situation. I'm going to go over 7 strategies with you that for your mental wellness for adults, and I'm also going to talk about 4 strategies that are very helpful for youth and children. And we're going to discuss where you can find additional materials on this topic, as well through our website here at Bryan, and then additional resources if this anxiety, stress, and depression become overwhelming for you here at Bryan, as well as through some national hotlines. It is important that everyone realize that some level of anxiety is normal. Anxiety is something that drives us to identify when there's a threat, and then drives us to the fact that motivates us to take care of ourselves, and drives us to find those things and those coping skills and the things that we take care of ourselves. But our community and our world is changing daily, and due to our current circumstances, and this brings additional stress and concerns, and it's that wear and tear of that chronic stress that is the concern. So this makes that self-care vital during this current time. So there are some things that you can do to help manage the stress that's going on for you currently. So I'm going to go through 7 things that I want you to pay attention to. The first thing is, on a daily basis, it's important to practice self-care through breathing and relaxation. So throughout just your daily routine, it's important just to take a few minutes, take some deep breaths, practice some relaxation, and to think about positive things. The second thing is to, in terms of staying positive, is to think about positive things and to start a journal. So a journal can be just any kind of a notebook, and where you can write things down, and where you're talking and practicing that positive thinking in your mind. There's a lot of negative thoughts, a lot of negative things that are happening in the world right now, and it's important that we stay positive and we look at the positive things that we have going for us. Third thing is that we stay connected. We do need to keep our distance from each other, but that doesn't mean that we can't stay connected through social media. We can use email, text, phone, many social media mechanisms that are out there. The fourth thing is that through those connections, it's important to take that connection a step further and to connect with family members and somebody that you trust, so that you can process some feelings that you might be having. So if you're feeling stressed and you're feeling anxious, that you talk to somebody that you can trust. So if it's a close friend, a family member, and you process the feelings that you're going through. Fifth thing is have some fun. I mean, this is a time where you can pull out your favorite movie, something that you like to do, and have some fun. The weather is going to get better. I mean, it's gloomy today, and the forecast shows it is going to get better. That means that you can get outside, you can enjoy the nature, do something fun for yourself. Number 6 is do avoid too much exposure to information. There's a lot of information out there about COVID-19. It is important to stay informed. So, listening to, the press conference, through information to find out, what is happening, what is important, but don't get overindulged with too much information. And then the last thing for adults is kind of the foundation for all of this, is you need to do the 3 basic things that I always encourage folks to do. Is it's important to exercise. Even though that maybe your gym is closed and the things that you normally do or did, you can't do right now. There's a lot of online exercise routines that are coming out and different things. Go for walks, go for a run. It is important to continue to exercise, maintain that healthy diet, and then important to get a good night's sleep. So balance those 3 things. If you want some additional information about those 7 items and some more information, we did post a blog on coping with stress during an infectious disease outbreak on the Bryan Health website on our blog earlier in the week. So I encourage you to go to our blog and find that information. The next thing I want to talk about is for kids. So it's important that with your children that you talk and answer questions. Have daily discussions with your children. Ask them if they have any questions about things that they may have heard, any concerns or fears that they may have had, and then go over the facts with them. Don't share too much information, but just enough information that will answer their questions and to alleviate their fears and reassure them that they are safe. That's number two. You know, our community, Bryan Medical Center, many folks in our community are taking extra steps to assure that our community is safe and that we're taking extra precautions to assure that we are ready for this crisis. Number three is the same thing for adults. You know, limit that media exposure for youth. The number four is keep a structure, and that also is important for adults, but especially for youth. Sit down with your youth and work out a structure with them. Get their input and plan out a routine for their day. It's important for them to have a routine so that they have a routine just like they had if they were going to school. Bryan Medical Center, we did put those four things into a Facebook post. So if you want more information about supporting your child, that is also out on our Facebook page as well. But if you find that anxiety is overwhelming and you think that's impacting your job and your daily life, we do have some depression and anxiety screenings on the bryanhealth.org website. So I encourage you to go to our website, take a depression and anxiety screening. If you find that your sleeping routine has changed, your appetite has changed, you're feeling overwhelmed, becoming more irritable, things are just changing for you and you're just feeling just not yourself, and that's going on for a period of a couple weeks, it's important that you go onto our website and you take that screening. That'll provide you some direction. It's not a diagnosis, but it'll give you an indication if those symptoms are an indication of possible depression or anxiety. If you feel like you're having thoughts of suicide or self-harm, it's important that you contact 911, call the National Suicide Prevention Hotline, 1-800-273-8255, or come to the Bryan West Mental Health Emergency Room, which is available 24 hours a day, 7 days a week. And as we have mental health professionals available to evaluate, to determine if hospitalization is needed for your mental health emergency. Thank you, and I'll turn it over to John.
Thank you, Dave. I'm John Woodrich, CEO of Bryan Medical Center. I wanted to highlight two items. One that we talked about yesterday, and that was our visitor policy. We do want to reemphasize again, we're trying to limit a maximum of 2 visitors per patient. So we will be screening people at that time. If there's any way that you could just have one person come along, that's even better. But it is causing a little bit of a slowdown as people come into the facility, but it's the right thing to do. We're doing social distancing as well. So you may notice differences if you're a visitor and you come into the cafeteria, food will be served to you. We're trying not to have people touch handles on different items and things like that. I did want to cover again in relationship to our easy visits, that if people want to be screened, that's a great tool to utilize. And then if the physician at that point in time would say you need to come in for additional screening, going to our urgent care, we have a separate entrance for anybody with an upper respiratory infection, and you're able to enter through there. Probably will have an influenza test done. That takes about 15 minutes to get the results. If that does come back positive, depending on the time frame, they may put you on Tamiflu and send you home. If that comes back negative, they could do what we call a respiratory pathogen panel. They will ask, again, that's a swab technique. That takes about 2 hours. So at that point in time, you'd probably be instructed to go home during that period of time. If nothing on that panel comes back in a positive nature, so it would go ahead and tell you if you've got rhinovirus, RSV, there's other coronaviruses, but not the COVID-19 on that. If none of those are positive, then they look towards, are you showing some of those symptoms that we need to have a conversation with the state health department for the potential of doing a COVID testing. We find out on a lot of these, we basically will ask people, to go home and self-quarantine, because if they're not having those breathing issues and haven't run a temp for a long time, that's probably the best thing to do. But we're working with our state lab in reference to that. Just like any of the other organizations, we too within Bryan are looking at an avenue that we can do that COVID-19 testing at our lab inside of the hospital. We continue to work on that. And a lot of people have asked us about supplies. Yes, we're keeping a real close eye on it. There's certain things we're running low on, and it could be test kits, but we're working through our supply chain, and right now we're able to keep up with it. But a future thing is we're going to turn to our state and to our Federal Reserve in relationship to their stockpile and try to access some of those supplies should this go and spread even further. But right now we're in a decent situation that we're able to handle the patients that are coming into our facility. So with that, I would like to open it up to any questions that anyone may have through the chat line. And maybe I shouldn't have used the term reserve, but it is basically a stockpile that they have of specific supplies for when you have pandemics or emergencies, that we as hospitals, as we set up command centers and go through the appropriate channels, that we can start to access those supplies. It is something that they will ration out appropriately as they're trying to take care of, at least from a state perspective, the entire state. And then from a federal perspective, they're looking at the spread of this across the country. So we just have to make sure that we create those appropriate channels so they know of what we're short of so that we can continue to take care of people in this region.
Hausman donated 9 PAPR hoods with motors, and a PAPR is a powered air purifying respirator that the healthcare providers will, they wear for protective purposes and so forth. And obviously those are in high demand and very closely monitored right now. And as we look at different entry points to the organization, expanding them to, additional areas is incredibly helpful. The ones that they donated are primarily for industrial use, so they're a little bit different than ours, but they will function in this arena and they can all be cleaned. And then the Samson N95 mask, they're not like the typical ones that you might see. They are kind of an industrial strength, a little bit heavier. They all need to be fit tested, and getting that many in is going to be extraordinarily helpful, and be able to spread those out throughout the organization to not just the people in the EDs or working in the highest risk areas. They can be distributed to other providers and nurses who are seeing patients too with perhaps undiagnosed COVID. So could not be more helpful and appreciated by us.
Well, pets are definitely good for your mental health. And so if you do have a pet, it's important you do spend time with your pet. And but as far as taking in pets, I have not heard of any information and do not know of information as far as exposure to COVID-19, so I would not be able to give information on that piece. But as far as your mental health, it definitely is good for your mental health.
I think Bob covered the items, but primarily it is that protective equipment. And the testing kits. So you can go ahead and see your supplies start to run down on, let's say, just isolation gowns that you wear, and you're waiting for the next order to come in, and we're seeing that kind of occur at a slower pace, or that if you order 1,000 of something, they may only ship you 500, because everybody right now is in this situation where they're trying to assure that they have enough to take care of their community. So I can't tell you that there's an item that we have fully run out of. It's just that we're staying on top of it from a supply chain, and we're looking for a variety of sources where to obtain this equipment from. So that's why I say we're still okay right now. But if we get to that crucial stage, that's when I think we're going to have some serious conversations at the state and federal level if we need to get our hands on some of these crucial supplies for us. Two of the key things that we are looking for in this, if these individuals have been running a fever for a few days at 100.4 or higher, that is a good signal, and having difficulty breathing. And if we feel that somebody has come in here and We've talked to the state, and they just have made the decision not to do the testing. If we feel that person is at any risk, we will admit them at that point in time. But we're being very selective. If people aren't having those issues with breathing, that is a key one for us. Temperature, depending on the height of that temperature and for how many days. So we are doing what is appropriate because, you know, I think now we're in a season as well. This past week, I think we've already had over 50 some influenzas. So that is still out there, and it's just that panic that we don't want to see occur, and we want to be diligent and follow a criteria of how we're addressing when people look to us for services.
Yeah, your mental health is just as important as your physical health. So it's vitally important that you practice that self-care and practice those tips and things that we talked about, to practice the relaxation, to monitor those symptoms of stress and anxiety, because with the chronic stress and the current changes that are happening on a daily basis, and we're finding that we're constantly exposed to those changes on that daily basis, and that stress and anxiety levels are high. And as I mentioned earlier, it's normal to have some anxiety, but since the anxiety level is as high as it is, it's important that we constantly practice that self-care, and I can't stress that high enough that that's very, very important. So as I mentioned, we do have the depression and anxiety screenings on our website. Use the social media, connect with your friends and family, but if you do feel like you need to connect with a professional, know that we have the resources available through information on our Bryan Health website.
We have been in close contact with our agencies, and just recently the Unified Command Center has allowed me to be a liaison from the healthcare perspective on their committee, so we will be meeting twice a day in reference to that. I can tell you Russ Gronwald has been in contact with the governor, and that seems almost on a daily basis. So I feel at this point in time we're getting the support that we need, and I think everybody, as we continue to look at this, folks are saying let's be prepared, because if you just look what's happened across the world and what we're seeing in this parts of the country, there is a good potential that a surge will occur. So we're making sure that we're preparing for that, and there's a lot of plans are happening behind the scenes. Thank you.